Hello everyone, today we are going to be discussing thyroid cancer. I chose thyroid cancer because hyperthyroidism, which is a specific type of thyroid disease, runs in my family, so it's something I pay very close attention to, just to make sure I'm always on top of it and making sure that I'm free of any of those issues. So thyroid cancer is cancer that attacks the thyroid gland. And the thyroid gland is responsible for all the hormones that regulate metabolism. So that's your food digestion, heart rate, blood pressure, and body temperature. There are four main types of thyroid cancer. They all vary between severity levels and differentiate with some symptoms. Thyroid cancer is typically benign and treatable, especially if caught early. Thyroid cancer typically isn't a fatal or very serious cancer. So the four types of thyroid cancer: the first type is papillary. That's the most common. It grows very slowly and usually only in one lobe of the thyroid gland, so it becomes even easier to treat and take care of. Follicular, which is the second most common, and is due to a lack of iodine in the diet. This specific type of thyroid cancer can spread to the lungs or the bones, so that can be a little bit more serious. Medullary, which is more uncommon, it develops from the sea levels within the thyroid, which is responsible for regulating calcium. There's two types of that kind of thyroid cancer, which is sporadic, that is uninherited, which means you don't get it from any family. It's not a specific hereditary trait within your bloodline. And then familial, which is inherited. And then last is anaplastic, that is very rare. It develops from existing cancer infections and then spreads very quickly, becomes hard to treat. This is one of the more severe thyroid cancers that can become a very serious and or deadly issue. So the cells impacted by thyroid cancer are the follicular cells. So those are the thyroid hormones specifically. And again, those hormones are important for controlling the speed of your body's metabolism. And the majority of thyroid cancer stems from these cells. Another type is parafollicular cells. Those are the C cells that produce the calcitonin that regulates our calcium levels. And then the actual cancer itself are nodules, which are small lumps that grow inside the thyroid glands. Most of them, again, are harmless, but can be cancerous and malignant. So usually in the early stages of thyroid cancer, you don't typically experience many symptoms. It's not until you are diagnosed and know that you have this specific type of cancer that you begin to become aware of these symptoms. But it can be lumps or swelling in the neck, pain in the front area of the neck, trouble swallowing or breathing, changes to the voice that do not go away. So that could be raspy, coarse, as well as constant cough. So thyroid cancer is luckily very treatable. It's one of the more treatable forms of cancer, and there's many options. You can get surgery, which removes all of the tumors from the gland. There is radioactive iodine therapy or external radiation therapy. This helps to destroy the thyroid gland as well as those cancerous cells. Thyroid hormone therapy, which is a hormone pill that helps to regulate and regrow that gland and help to regulate those hormones that are being affected by the cancer. Targeted drug therapy, which is similar to the hormone therapy, and then chemotherapy, which is is a very common treatment for all forms of cancer. So again, for thyroid cancer, it's a cancer that attacks the thyroid gland. There are 4 main types. The follicular and parafollicular cells of the thyroid are affected. Symptoms can be lumps or swelling, pain, trouble swallowing or breathing, constant cough, and change to voice. Thyroid cancer is very treatable, and there are various options for treatment.